Hi, my name is Atiyya from Munim. Today I will be telling you a story about a patient called SM. SM was a 35-year-old male who was admitted to the medical wards at the Moi Teaching and Referral Hospital. He came in very ill and we started workup immediately. After doing this, we found that he had leukemia, which is a blood cancer. Despite being so sick, he was still a very jovial patient. He was always walking around, laughing and eating, but this didn't last very long. His HB kept dropping and he desperately needed blood. He kept trying to get people, friends and family to donate blood for him, but that never came through. Within 2 weeks, he stopped walking around, he stopped talking, and he stopped eating. His condition was worsening. He desperately needed blood. Within 2 weeks after admission, SM died. SM is one of the very many patients who die due to lack of blood. Did you know that if you donate just 1 pint of blood, you can save up to 3 lives? This could be someone's wife who just had a hemorrhage after delivery. This could be someone's father who had a traumatic road traffic accident. Or this could be someone's little child who's suffering from a chronic illness. According to the WHO, if only 1% of a population donate blood, it would be sufficient to sustain the blood needs. However, this is not the case in developing countries. In Kenya, we have a blood deficit of more than 300,000 units. 70% of the blood donations in Kenya come from high schools. We thought there had to be a better solution to solve the blood deficit problems because whereas blood demands are increasing, the supply is just not being met. So we came up with Uhai.
So currently there's no direct way of linking patients in healthcare facilities and donors to blood transfusion centers. So we had to really think out of the box with this one. And so we looked into the statistics and numbers. Did you know that around 60% of the world's population owns a mobile phone? That roughly translates to every 2 in 3 people owning a mobile phone. Insane, yeah? So we decided to harness the power of the mobile phone, and hence Uhai was born. Uhai is a Swahili word meaning life. And our Uhai is going to be a blood donation integrated system that will consist of 2 systems. One as an application for smart phone devices which have internet and GPS compatibility, and the other one will be utilizing the USSD system. To demonstrate the application alone, I'll take you through this short tutorial. So Uhai is a blood integrated system that will connect those in need of blood with potential donors willing to donate but do not know when and where it is needed. As mentioned, we will have the application for smartphones as well as use the USSD for other phones. Through the USSD system, Uhai will be able to ensure communication via text messaging or SMSs, encouraging blood donation irrespectively. We will also develop a centralized PC or computer-based system for hospital institutions who will be able to have the option of making multiple requests for in-house patients. So Uhai will be able to be availed to Android users on Play Store and also to iOS or Apple users on the App Store. So after downloading the app, just like other apps, the user will be able to create a profile by filling in relevant demographic information including gender, weight, due to threshold cutoffs in hemoglobin level eligibility, last date of donation, and any known chronic illnesses. So users will be able to view this information in the profile menu, in the drop-down menu in the profile option. So there you have your age, gender, weight, blood group, region in Kenya, and chronic illness description. So note that the names will be kept, although it appears here, they will be kept anonymous at all times, respecting the confidentiality policies of blood donation in Kenya to ensure the voluntary safe nature of blood transfusions. Names only appear on your profile for your own use and for logistical traceability. So if you're a patient and you have the application and you're in need of blood, you just get the app. That way, fill in the sign up, and click the request blood option. So you'll be able to select your blood group if you know it, or be guided by the nurse after grouping and cross matching is done. Select the region you are in Kenya and the number of pints needed as prescribed by the doctor. So using GPS features, the app will be able to locate eligible donors within a fixed radius of vicinity through a programmed algorithm, vetting out those based on things like last donation intervals, such as males able to donate after 3 months and females after 4, and then send out requests for them. So if I'm a donor and I have the application, I'll find something like this. I can accept or reject. So the patient can track the progress of the transfusion processes as through accepted notifications, and be reassured to receive blood within an estimated period of time. So if you're a random ongoing donor, you can also get the application and just click the option of donate blood. Then you'll be able to just select the region you're in and fill in the questionnaire for the National Blood Transfusion Services donation. Instead of queuing in line, upload it and submit. You'll then be guided through a Google Map-like manner to the nearest blood center to donate blood. Uhai will basically be a blood Uber, but definitely more. Just like that, you'll be guided to various transfusion centers next to hospitals where patients who send out requests also are in. So it'll also be used as an educational platform to enlighten the public on general information, blood grouping and cross-mine, donor eligibility, and blood donation, to eradicate false myths and conceptions on the likes, and to stress the importance of blood donation. So Uhai users will all be able to get regular reminders and track it and track their history. They'll also be notified on upcoming blood drives and their locations and also be able to be notified in case of emergencies and catastrophes to mobilize users. The app will also have this rare blood groups database to help find donors, and also have the blood buddy feature to help donors regularly donate to people in constant need of blood. So there you have it, all the options of in Uhai. We're hoping to finalize on the app development and release it to everyone out there.
I am going to speak to you about the advantages of this app. So while we were working through the concept of the app, one of the biggest advantage that we saw was that this app would be able to bridge the gap between our patients, the health centers, people willing to donate blood, and they will do this through the blood transfusion centers. In Kenya, we have a high mortality rate because of patients have to wait a long time for them to get blood for transfusion. They don't do the procedures they need to do in time, and so the mortality rates go high. We hope that this app will be able to lessen that. Also, something that is very important to us is that this app will give power to the patients. They will be able to seek out blood when they want. They will be able to follow up the progress, which gives them peace of mind, and this will be good for the patients, and they will feel that the power is in their hands and they are in control. So our target consumers of the app will be people aged above 16. For donors, of course, they are eligible, but for the recipients, there is no age limits. We also hope to serve hospitals, and we hope that this app will be especially beneficiary in terms of crisis, where we would need to mobilize a lot of donors to fill in the blood donation gaps.
I have been a doctor for more than 10 years. Where I currently practice, there are many times that patients need blood before procedures, or at times for those who have cancer before chemotherapy, or at times a patient is just bleeding and all they need is blood. And many times we do not have the right blood. What I mean by that is the right blood group, the right quantity of it. And an app like Uhai is very, very important because it will be able to connect patients, hospitals, and donors so that we might be able to get the right quantities of blood and the right blood group for patients.